All right, I'd love to get going with our next session, really looking at some of the mental health issues that accompany a diagnosis that has this high rate of recurrence, very invasive surveillance required. There's a lot of factors that come into play. And we're really delighted to have Dr. Sarmak Lolak. He is a staff oncology psychiatrist at the Life with Cancer Center and part of the physician team at Inova Shar Cancer Center in Fairfax, Virginia. Dr. Lolak has been working primarily with medically ill patients since 2004, so he has a lot of experience. He's currently a fellow of Academy of Consultation Liaison Psychiatry and serves as a clinical professor of psychiatry at George Washington University and associate professor of medical education at the University of Virginia School of Medicine at the Inova campus. Dr. Lolak specializes in the management of mental health issues such as depression, stress, and anxiety in the context of cancer diagnosis and treatment, including drug interactions between cancer therapies and psychiatric medications. He also has a special interest in mind, body, and contemplative practices, especially mindfulness and compassion cultivation. And what I think is exciting is he's going to introduce this concept, and we're going to do our mindfulness breakfast with our two patient advocates tomorrow morning as well. Dr. Lolak has co-authored several publications and given a number of presentations. So I would like to invite Dr. Lolak to come on up and take over. And we'll save questions to the end. And then, John, if you don't mind, that would be awesome if you would run around for questions. There you go.
Okay, so everybody hear me? Good, thank you. So thank you, Stephanie, for the introduction and for having me, and thank you, BCAN. And I really appreciate this opportunity to speak with you about some of the strategies that we can do to help with the issues of stress, anxiety, fear, when you're dealing with cancer diagnosis and treatment, right? And I really enjoy, hearing you asking questions, and I hope that at the end of the talk, we'll be able to answer some questions. So I like the interactive nature of this summit. So first of all, as you know, cancer doesn't only affect your physical health, right? But it also affects your emotional, spiritual, and also cognitive health. So there's a lot going on that cancer patients, survivors, and family have to deal with. Not just the physical side, but also the emotional and mental health side. So first, I'd like to kind of talk about the definition of fear and anxiety, right? So this is sort of the topic today. So as you know, it's a spectrum, meaning that it could be really normal, right? On the one end of the spectrum, or it could be pathological on the other end. So what is fear? Fear is a reaction to some sort of clear and specific threat or danger, right? And it could be a reasonable fear, or it could be really kind of out of proportion fear. Nevertheless, it can cause a lot of distress. For example, if you may have a fear of losing your job, right? If there's some changes in your workplace, there's a new boss coming in, or you can have a fear of cancer recurrence if you know that there's a high rate of recurrence with the cancer diagnosis that you have. What about anxiety? So anxiety is sort of a less specific, kind of vague worry or apprehension of fear. And usually, oftentimes, it's about the future, right? But the kick is the brain doesn't know it, right? Oftentimes we worry about things that hasn't happened yet. Usually the worst possible outcomes that could happen, right? In the future, it hasn't happened in the present, but the brain doesn't know the difference. When you have that thoughts about worry about the future, the brain actually reacts to it as if those things that we think about is reality, right? So it starts to go into this fight or flight or freeze mode, pumping the adrenaline and then causing all these symptoms of anxiety and fear that you experience. So we'll talk about some of the ways to train the brain or to train the body to be able to recognize those things and how to help with that. So the anxiety can be situational, right? You all know that situational anxiety could be episodic, comes and goes in waves, or it can be constant all the time in the background, which happens to some of the cancer survivors that I see. And oftentimes, especially in the context of dealing with medical diagnosis or cancer diagnosis, usually the sense of uncertainty, right? The incomplete information that you have about your prognosis, about your treatment plan, often induce that anxiety. And if the anxiety becomes excessive or it starts to interfere more with your daily function, then we diagnose the patients with anxiety disorder. And this is, you probably notice from your own experience that it can happen at any time of change in your medical treatment or crisis point appointments. The terms scan anxiety, right? For cancer patients, anxiety around the scan or the procedures, or it could be ongoing in some patients as they sort of embark in this journey of being a cancer patient. Well, I just want to put a note here that sometimes anxiety symptoms can indicate medical problems or the side effects of the medication. For example, if you have a lot of pain, it could cause a lot of anxiety. There's some medicines such as steroids that sometimes be given with some chemotherapy can cause acute anxiety symptoms, or even some medical problems like hyperthyroidism or pulmonary embolism can cause or mimic symptoms of anxiety. So if all of a sudden, you experience really bad anxiety, you're not really sure why, and there may be some changes in your medical treatment or other symptoms, you want to check with your healthcare providers first. And there are many a variety of symptoms of anxiety. Start with physical side symptoms, muscle tension, headaches, trouble breathing, palpitation, heart racing, nausea, aches and pains, can be insomnia, can be symptoms of anxiety, right? On the emotional side, about excessive worrying, could be in the form of irritability, easily annoyed, easily irritable, feeling kind of on edge. Or it could be the fatigue, don't want to do anything, want to sleep all the time, having trouble paying attention, or even having trouble with short-term memory. And the behavioral side of symptoms is sometimes being obsessive compulsive, just consumed by those anxiety and unable to kind of think about something else, or it could be avoidance, right? Starting to avoid the things that trigger the anxiety. What about treatment of anxiety? I'm just gonna sort of give you an overview of the treatment. The type of treatment that has the most scientific evidence to help with anxiety symptoms and anxiety disorder is in the form of counseling or psychotherapy, particularly the type of psychotherapy that we call CBT or cognitive behavioral therapy. So this type of treatment help you recognize the pattern of your thoughts that we call maladaptive thoughts that sometimes make the anxiety worse or cause the anxiety symptoms. For example, the thoughts that we call catastrophic thinking, and then they couple it with some behavioral techniques to help managing the anxiety, in your body, and also some behavioral activation of what to do to help with the anxiety. So that's CBT. But other type of therapy also works pretty well. Then you have what we call the category of relaxation exercise. Could be breathing. Breathing techniques works really well for anxiety, mild anxiety. Just slow down, do a deep breathing in and out can really help. There's a specific technique called progressive muscle relaxation. You can look it up. It's kind of from head to toe, you tense the muscle for a few seconds and then you relax it. And then that's been shown to reduce anxiety in a variety of medical problems. Guided imagery, like when you listen to meditation and it tells you to imagine being relaxing at the beach, sky's blue, and then everything is good, and then you breathe slowly. So that's one type of practice, right? Stress management in general, and that encompasses a lot of things. Healthy coping can help, and I would include things like massage, right? Because it's a way to relax your body from the bottom up. Right? Therapy sometimes can help with the top down, but anxiety also lives in your body. So you want to find ways to help your body learn that everything is okay right now in the present, even though we worry about the future. So massage help, energy work like Reiki. There's a lot of evidence for that. Healthy hobbies, to distract your mind, right? To help you focus on something that it's joyful, it's purposeful. Spiritual practice is a big one, right? Because it helps give you that calm feelings, hope, and purposes. And then there's category of mind-body intervention. Mindfulness. We'll talk about that in a minute. Yoga, yoga is a really good way to help you connect your mind with the body, right? To be aware of what are you feeling at the present, what's your posture, where in your body that you feel tense, how do you breathe, those kind of things. Acupuncture also has some evidence. And then self-care. I cannot emphasize this enough, right? Exercise has a lot of scientific evidence to help with anxiety symptoms, either mild or moderate, but it has to be more than just walk around the block slowly once a day. It has to be a little more intense to use exercise as a treatment for some of the mental health symptoms. You have to be able to work your way up to about like 3 to 5 times a week, 30 minutes or a little bit more with the intensity that you feel really kind of wipe after the session. So that's the intensity that we're looking for when you want to use exercise for some of these symptoms. Nutrition, other type of self-care, nutrition, sleep, are also important in managing your symptoms. And then lastly, the medication. These are the options for some of the anxiety symptoms, especially when it really start to interfere with your daily life or your medical treatment. So I want to touch on this syndrome or symptoms that we call PTSD, post-traumatic stress disorder. I think patients who are veterans probably familiar with this term, right? PTSD. But there's also a lot of literature suggests that experience dealing with cancer, either the diagnosis or treatment, can associate with PTSD symptoms. So as we know, a lot of patients, when they go through the experience of cancer diagnosis and then treatment, especially some of the invasive ones, whether it's if you found yourself in the ICU or have a really invasive procedure, they may experience those events as traumatic, right? So that's known. But in the studies, it showed that only a small portion of the patients actually meets criteria for a full-blown PTSD diagnosis. But nevertheless, even if patients have less than full-blown symptoms that we call subsyndromal symptoms, it's still associated with a lot of distress and affects their quality of life, right? So if you look, we look at the studies that look at the prevalence of PTSD in cancer patients, it shows that it's about 6.4%. They call it current cancer-related PTSD, and that number is actually twice higher when you compare with healthy U.S. adult population. The prevalence for that is about 3.5%, right? So there's clearly as association of cancer treatment and cancer diagnosis that increase the risk for having a full-blown PTSD diagnosis, and probably more when you look at the symptoms that maybe doesn't meet the threshold for a diagnosis, but still still very distressing. So again, I want to give you sort of a gist of what does PTSD mean from the brain standpoint. So the way I look at it is when trauma happens, right? Whether it's you lose someone in a traumatic fashion, something happened to you in a violent, traumatic way, or including some of the traumatic experience from your cancer treatment or cancer diagnosis. It should be a memory, right? Right now, but the brain doesn't know that. So PTSD is when the brain doesn't know that the trauma is a memory. So the brain, again, we talk about the brain doesn't know the difference. So this time, the brain acts or reacts as if the trauma is still happening, because the memory of those are so traumatic that it doesn't consolidate in the brain. It's still floating around in the brain and causing some of the symptoms of PTSD that I'll talk about in the next slide. So I'll go over this real quick because this is, you can Google it. Just want to give you an idea of the formal criteria for diagnosis in psychiatric world. So we use the criteria that's called DSM-5. This is a criteria that was put forth by the American Psychiatric Association, and it's a standard criteria that we use in research, we use in clinical diagnosis, we use in treatment and things like that. So the way we diagnose in psychiatry, especially for PTSD, is to meet the diagnostic criteria for PTSD, right? And I want to emphasize again that a lot of patients, they may not meet the threshold, but still, they need help, they need support, they need treatment, and they're still, in a lot of distress. But the criteria goes like this. So number one, criteria A, you have to have a stressor that qualify as a traumatic event. And in some situation, a cancer treatment, the way that a cancer was diagnosed, would qualify for that. And then the next criteria is what we call intrusive symptoms. Again, this is the symptoms that the brain experience those memory as if it's still happening right now, right? So you have nightmares, you have flashbacks of symptoms, you have sort of what we call intrusive thoughts. A lot of symptoms when you're reminded of the triggers of the event that was traumatizing, and then a lot of physical reaction. And then the next criteria is called avoidance. So basically, many, if not all, PTSD patients, because it's so traumatic, it's so traumatizing, right? So distressing to be reminded of those events. They, spend time avoiding thinking about it, avoiding watching, movies about it. But oftentimes, especially in cancer, you cannot avoid it, right? I mean, every day you see some TV ads about cancer. People with cancer. You have to go to the doctor. So that's why it's challenging. The next criteria is negative alteration in mood and cognition. So, for example, they might feel down and depressed, having trouble with memory, having trouble motivating, having joy in doing things, and then feeling isolated. The next one is called hyperarousal. So a lot of patients will have these symptoms that their body doesn't know how to settle down, right? They're in a state of fight or flight all the time. They're easily startled, any little sounds and noise, get them worked up, or become easily irritable, hypervigilant, always scanning the room of things that, may trigger them, having trouble sleeping. So those are some of the example. And then the last three criteria is just the duration, that to qualify for this diagnosis formally, right? The symptoms have to happen more than a month. It has to cause some functional impairment, and then that it doesn't it's not from other medical problems or substance use, or medications. So that's the criteria for PTSD. And then we know that for cancer patients, if they have these risk factors, they are highly they have more association, or they're more likely to have PTSD. For example, if they have pre-cancer trauma history, they have a rough childhood and then losing someone, and then being a traumatic situation, and then diagnosed with cancer, or have a traumatic event from cancer treatment, then the likelihood that they will develop full-blown PTSD symptoms higher. If they have history of PTSD, I think that's I think that makes sense, right? That the symptoms would come back. Low socioeconomic status, because they usually have a lower degree of support and have harder time access to the care. Young age is a risk factor that shows up over and over in a lot of studies. Limited social support, advanced disease, invasive treatment, right? This may be relevant to bladder cancer because we know the treatments are pretty invasive and it can be distressing just to go through, or just to know that you're going to go through that over and over. And then if they have a lot of dissociative symptoms, like unable to recall that day, when the doctor talked to them about the diagnosis or the day of procedure, that could be part of PTSD symptoms. Well, I mean, unfortunately, there are really not a lot of studies that were done. I mean, there were not a lot of studies that were done for patients in cancer to begin with. But when you narrow down to studies that were done in bladder cancer patients, there's even fewer. So, I was only able to find, one good paper from a couple of years ago that talks about this. And as you know, right, because bladder cancer patients has a high recurrence rate. So this study looked at the NMIBC, so non-muscle invasive bladder cancer patients. We know that, they have to have frequent surveillance, frequent up to every 3 months cystoscopies, which can be painful, can be traumatic, it can be anxiety producing, and then repeated intravesical treatment for some of them long-term, right? So this actually, those are the risks for PTSD symptoms, right? Because it could impact quality of life. And for some patients, if the symptoms are so bad, especially the avoidance, right? It may lead them to avoid going to the doctor, avoid getting checked, avoid treatment that actually may impact their health outcomes. So in this study, they found that almost 30% of participants meet criteria for at least one of the symptom cluster, right? Even though they don't meet the actual diagnostic criteria for PTSD, but they actually have at least one of the symptoms that I mentioned in the previous slides, whether it's intrusion, avoidance, negative mood, or hyperarousal. And after they control all the variables, again, the risk factors are young age, they have active disease, more comorbidities, they have multiple medical problems going on at the same time, they have low social support, and also higher cognitive concerns. So those are the risk factors for bladder cancer patient in this particular study to have more PTSD symptoms. And again, because we don't have a lot of studies, even in cancer patients in general, so the evidence for treatment specifically for cancer patients PTSD is very limited. So of all the studies that was done, there's oftentimes the small samples, methodological problems, so it's hard to find good conclusion from it. But fortunately, we can extrapolate from the evidence for the treatment of PTSD in general, and that's kind of what we do in clinical practice, right? A lot of things that we know work for to support or to help PTSD patients in general, I think would generally work for cancer patients, maybe with a little bit of tweak in terms of to adapt to the context. So for example, again, CBT, cognitive behavioral therapy that I mentioned earlier, still has the best evidence for PTSD treatment. There's a specific type of treatment called EMDR, or eye movement desensitization and reprocessing. Some of you may have heard or watched a video on tapping. So it's kind of used that same method of tapping alternatively to help the patient process their trauma. Right? But even other kind of more general treatment that we have, like counseling, support group, stress management, can also be beneficial in these symptoms. So talking about the distress and trauma that caused by the cancer diagnosis, right? But there's on the other hand, things like cancer diagnosis or treatment can also cause some it can also lead to some positive changes, whether it's your priority and values, your view of self or the others, and also a sense of meaning and spirituality. Right? You may have heard stories that there's a silver lining. Not that you need to have a cancer to have those growth, but that there's a term that I think we call post-traumatic growth, or stress-related growth, or existential growth that many cancer patients reported. Right? For example, they report improved relationship with the others after going through cancer diagnosis and treatment. Report new life experience, whether it's change in their life priorities, career choice, or greater appreciation of life and greater sense of gratitude, right? I see some people nodding, so I think you can relate to that. Or a sense of personal strength, right? You're able to come up with new narratives that you tell a story about yourself, that you overcome that adversity in dealing with the cancer, and now feeling empowered. And then spiritual development. I just want to emphasize that this doesn't mean that having cancer or having trauma is good. It's not, right? But nobody can choose not to have cancer. It happens. But we have a choice in how we respond to the adversity, right? And post-traumatic growth and PTSD are not mutually exclusive. A lot of people experience both, right? Doesn't mean that if you have this sense of appreciation, doesn't mean that you don't suffer from those symptoms, the flashbacks, the avoidance. It can happen. It can coexist, and it's also not universal. It's okay if you don't feeling these changes, this growth. It's perfectly okay. It's not universal. So that's sort of the first part that I want to talk about, some of the anxiety symptoms and overview treatment. But now I want to kind of give you some practical strategies, things that you can do day to day, right? When you experience anxiety. So the first rule, when dealing with anxiety is acknowledge it. Do not deny it, right? If you feel anxious, you feel like you're not doing well, acknowledge that and find a way to find support or find a way to manage it, right? But don't over-identify with it, meaning that I'll talk about in the next slide, like the way you look at anxiety, you want to look at that this is the feeling that comes and then it passes away, right? You don't have the same anxiety 24/7. And this one is really important. You want to create some healthy routines and stick to it. The reason is routines makes your life predictable. It makes your brain predictable, able to predict, the events in your life, and it helps regain that sense of control that oftentimes, we lose it when dealing with cancer. That's part of the reason we feel anxious, right? So it could be any kind of routines. Morning routines, how you wake up and then you brew your coffee and then read the paper. Exercise routines really important, right? Because it's healthy. Could be nighttime routine, how you wind down, could be weekend routine, social routine, and things like that. So whatever routines that you can establish, you can install in your life, that will really help with the anxiety. And this one is a little challenging, but I like you to think about it, and remind yourself often that dealing with this is always about a balance, right? Finding a right balance. Balance between what? Number one is between control and acceptance, right? Sense of control is important because when we don't feel in control, we feel anxious, we feel unsettled, right? But as you know, not everything is under our control, right? Especially when it comes to life in general, when it comes to medical problems, especially cancer, there are more things that beyond your control, even beyond your doctor's control, than things that you can control. So what to do? This is the old AA adage, right? You want to focus on the things that you can control, and then you accept the things that you cannot control. But everyone knows it, but it's easier said than done, right? So you want to work on it. You want to find that right balance. And to find that balance doesn't mean that you have to be in the middle every day, right? It just means that you kind of check yourself once in a while, like, am I need to work a little bit more on acceptance, or am I need to work on finding things that I can control, right? And then kind of keep that balance. Number two, what balance? Balance between enjoying the moment, right? You want to be in the present, you want to enjoy the moment, and you want to prepare about the future, right? Because as much as people say, you want to live your life as if this is the last day, more often than not, it's not your last day, right? It's not even your last month, or year, or decades. So you can't just, do everything as if today is the last day. You have to prepare for the future. You have to think about your retirement, your healthcare costs, your kids, your family. But you want to make sure that you're not doing that all the time, right? You're not just thinking about the future and then ignoring the present. Or if all you do is just thinking about today and not thinking about the future, that's not good either, right? So that balance again. And then the third balance is a balance between processing and experiencing the difficult feelings that you have. Having cancer, meaning that you've been through some losses, you've been through some traumatic times and events, and losses create grief, right? And grief needs to be processed to put in a proper place. So that's important. But at the same time, if the feelings are difficult, it's painful, you cannot do it all the time, right? You have to, when it's become too intense, or when it's not the right time, you have to be able to find some strategies to distract yourself. But you want to make sure that you're just not someone that, keep, using distraction, to avoid dealing with the losses, to avoid processing it, right? Again, just be mindful about where you are on the spectrum, and make sure that if it goes one way, too much, then you kind of pull back to the other way. And some of the ways that you can do to help process or to help reflect on your situation, your feelings, your losses, includes counseling, talking to either trusted friends or support group or a professional counselor. Journaling is a good one. It can be free form journaling, just to be able to express yourself. Some people like reading good cancer memoirs that speaks to them, that helps them reflect, find the right language, to describe their experience. Some people do it through art, through meditation, through play, whatever it is, that can help you. You may have to explore a few things to find what's right for you. And it's important that even though today or this past, couple of weeks, you're feeling bad, try to remind yourself not to project that feelings too much into the future or too long, right? If you're feeling bad today, you just got, bad news from the doctor yesterday, you're feeling really crappy, and you tend to feel like, oh, this is going to be how I feel the rest of my life, or how I feel every day from now for the next, how many months. Most of the time, it's not true, right? If you look back in your life at some bad events and you felt really bad then, right? If you had like a heartbreak, you broke up with someone you were younger, I'm sure that day, you thought that how could you live on, right? Just broke up with your boyfriend or girlfriend, but 6 months, 12 months later, it changes. That's how our brains work, right? Our brain has that amazing capacity, to adapt all the time, to create new connection and wiring, to adapt to the new situation. And so just remind yourself that. And again, this is the same with the post-traumatic growth slide, that you want to find, if it's helpful, you find some ways to create and develop that narratives. And sometimes talking, processing the feelings, talking with a counselor or journaling can help with this, right? You come up with the stories and narrative that you tell yourself, like how you overcame this adversity, you become empowered, you're stronger, now you have more support, and you're feeling optimistic about your journey. So that's the new narrative that you create for yourself. Right? And some people find that learning to shift perspectives helps with anxiety. This is actually from one of my patients. She used to be terrified at a scan. I have really bad scan anxiety. But one day, she had this epiphany that, oh, what does the scan do? The scan actually gives my doctor and give myself more information. And what does the information do? It's the knowledge, right? And knowledge gives me power, and that power gives me that sense of control, to be able to make the best decision for my health, for my life. So once that clicked for her, then her scan anxiety reduced significantly. So that's how you learn to shift perspective. Right? So what about when you're feeling really anxious at the moment, right? You might find yourself sometimes without any triggers at all, or maybe, when you're waiting to see the doctor, or when you're waiting for the scan result and you feel extremely anxious, what can you do? First, you want to notice the sensation in your body, right? Because anxiety lives in your body. Where in your body do you feel anxious? Where's the tension? Where's the anxiety? Is it the shoulder, the belly, the heart, the neck? Trying to locate that sensation and just be mindful of it. Okay. And then, this is the acknowledging, right? You want to acknowledge that this is how you feel. But instead of saying a blanket statement that I am anxious, even that, that's what we say all the time, but I like you to try saying it differently, saying, I'm noticing that sensation of anxiety, in my shoulder, in my neck. I'm noticing that I have a lot of ruminations about this and that. The reason is you're trying to train your brain that these feelings, this thinking happens, right? And then it stays and then it passes. It's not something that you want to over-identify with, right? So that's one of the mindfulness techniques. You want to make space for your anxiety, and you do that by a couple of things. You slow down, right? You slow down your breathing, you sit down, you breathe through it, right? Breathing is one of the most powerful things because we breathe all the time. We don't have to wait to have any equipment. We can just use our breathing to be therapeutic. You can do just slow breathing. If you don't know what to do, just slow down, by 3 or 4 times. Breathe, through your nose, out through your mouth, see your belly in and out. Or you can do some of the breathing techniques like the 4-7-8 breathing. I think Dr. Andrew Weil popularized that. You can see the YouTube video. Basically, you breathe in for a second, you pause for 7 seconds, and then you breathe out through your mouth for 8 seconds. That's really helpful. Or you can do what we call a box breathing, meaning that it's 4, 4, 4, 4. You breathe in 4, you pause 4, you breathe out 4, you pause 4, like that. When you do it, for a couple of minutes, your brain activates what we call parasympathetic nervous system, that counteract all the adrenaline or the sympathetic nervous system that makes you feel flight or fight. It calms you down. So that's the best thing that you can do, right? For some people, if they breathing doesn't helpful or they have trouble breathing, they can do using their movement, right? Slow, mindful movement helps. Some people like squeezing tennis ball in a mindful way. Or, if you one of those people that, you really feel like your anxiety is, you want to, jumping off your body, you just move a lot. You dance, you whatever. Sometimes that can be the best thing you can do to help with the anxiety at the moment. So rumination, what is rumination? Rumination is when you just keep thinking one thought over and over and over and over. Has anybody experienced that? Yes, right? All the time. Oftentimes it's at 3 a.m., right? And when you wake up, just having this random thoughts or one thought over and over, and you feel stuck. So to manage it, there's a couple of strategies, right? And this may not be in the moment at 3 a.m., but when there's time to reflect, if let's say you tend to ruminate about this one thing in particular, often one thing that you don't have an answer, but you just keep thinking the same thing. First, you want to ask yourself, why is it there? What purpose does it serve? How helpful is the situation or the goal that you try to accomplish? Right? Just to ask those questions. And oftentimes the answer would be no, right? It doesn't serve anything. It doesn't serve my interest to ruminate like this because I don't have an answer for it. It doesn't help me in any way or shape or form with my goals in life because I actually want to spend quality time with my family, but when I ruminate, I cannot, right? So at least you're aware that, this is not helpful. Because why? Because rumination, again, it's about control, right? Rumination is the brain or your body attempt to try to gain control of the future, even though, it cannot, right? It gives that illusion that you're doing something, that's helpful, but it's not helpful. So, as you can tell, sometimes planning about the future helps, right? But up to a point. But if you worry or ruminating about the same thing over and over, let's say your your doctor just gives you this scan result and tell you everything that they can about the treatment, but they cannot give you a specific number in terms of the prognosis or the future, and you just keep ruminating on it, right? Then it becomes less and less and less helpful. And for some people, just the rumination serve as an attempt, to distract from processing your losses, right? And it could be an unconscious attempt to get away from that because when you just, worrying about the future, you don't have to worry about the past. You don't have to worry about what has happened to you. You don't have to feel the feelings, that cause the pain and the losses because you're focusing on the future. So just kind of be mindful of that. Right? So what do you do when you find yourself ruminating? You want to use the techniques that I was just talking about, slow down, find a feeling in your body, breathing, movement, things like that. Once you feel a little settled down, you want to ask yourself first, like, what am I anxious about? A lot of times the thoughts are, kind of mix up in your head that you don't even know what you're anxious about. And it's okay. Sometimes, you wouldn't know it, but if you're able to identify a couple of things that you're anxious about and write it down, usually that can be really helpful, right? And then you pick one of those things that, you're ruminating about, you're anxious about, and then you ask yourself again, coming back to control, right? In this particular thing that I'm worried about, what is it that under my control and what is it that, is not under my control, right? And then is it really worth spending energy for? right? This particular thing, if you kind of pull yourself back and look at the big picture, this one little thing that you worry about, is it really worth spending energy for? Right? Does it really matter how important it is? If the question or if the answer is yes, right, it's worth spending energy for, then you think about what can I do now or later, right? So coming back to the things that are under your control, what's the next step that I can do to help with this situation? One thing that I can do that is consistent with my values and priorities, right? You can do many things, but if you want to narrow it down, you want to use your values and priority in life, to serve as your guide, right? Your action, right? Your action based on your values and your action based on your priority in life. And then again, how much energy should I want to spend with that? And then once you have that answer, right, whether it's no, it doesn't matter, or yes, it does matter, and this is what under my control, and this is what I'm gonna do next, and when and how, then you let go. If you have a hard time letting go, you distract yourself. That means that you already processed that worry, right? It's like if you have a piles of mail and you already, open the envelope and then you say, okay, this is a junk mail you throw away. This is, the thing that you have to send a check for. You write a check, and you say, I'm going to send it Monday, and then you don't have to look at it again, right? You let go. So again, coming back to the values, it's important that you know what are your priorities and values in life, because there's going to be a time, even not now or later, that you may have to make some decisions, right? That could be a lot of pros and a lot of cons. And the decision that you make, the one that you want to make, is the one that is most consistent with your values, whatever that is. And a lot of times, there's so many things that you have to worry about. Being cancer patients, dealing on top of everything in your life, right? So for people who have a lot of anxiety, I always advise that they kind of pull back a little bit. Instead of thinking, about everything in, 3 to 5 years, just kind of pull back and say, what about this next month, right? Or couple months, what are your goals and what are your priorities and what are the things that you can do differently or start doing or stop doing? Oftentimes that helps kind of pulling back, narrowing it down to manageable chunks. Of course, you still have to plan for long term, but most of your energy should focus on kind of short term things that you can do. Right? And then the last thing, has anyone heard the phrase FOMO? So FOMO is fear of missing out, right? There's a lot of that because of the digital age, right? We see Facebook, we see Instagram, and we see our friends, going on vacation in Europe or do this and that, right? We have that anxiety about missing out. When you couple with the fact that you have cancer, right, that creates anxiety because you start worrying that you might not have time for everything that you wanted to do, right? That's fear of missing out. But the reality is, we don't need a lot to be happy, right? So you want to sort of transform that fear of missing out to JOMO, which is joy of missing out, right? Right? Missing out can be joy. You just do a couple of things that you like. It doesn't matter if people go to Europe, it's or do this and that. But if you pick the few things that that will make you happy, is consistent with your values, again, it can help. Right? And then lastly, these practices can really help counteract that sense of anxiety, right? Gratitude practice, you may have heard of it. I think Oprah talks about it often. There's a lot of books and articles about it, but it is really a powerful practice. It's, in my opinion, in my clinical practice, it's one of the most powerful practice, easy practice that you can do every day. Meaning that every day, the way you do gratitude practice, at least the way that they did research on it, is every day before you go to bed or any time of the day, you think about 3 things. that went well today, no matter how big or small, right? Or 3 things that you feel grateful for. And you write about it, short sentences about it, 3 things. And you keep doing that every day, no matter, you have a bad day, a good day, no matter how big or small. It could be really small. Like, you have a nice coffee with a friend today, or it could be really big, like you got great news from your doctor. When you keep doing that, what happened is, number one, you start to relive the positive moments in your day, right? When you think about, oh, today I met this friend and I had a good time, your brain relives that experience and it makes you feel good. Number 2 is you start to prime your brain to start looking for more positive things, right? Our brain is like Velcro, for negative things, right? If one small thing happened, it ruins your day, right? If you go to a coffee shop and then, the person before you takes forever, it ruins your day, right? But, you're not aware that that particular day, there actually, 100, or maybe more, maybe 10,000 things good things that happen, things that go well, that you don't even notice, right? So by doing this practice every day, you start to prime your brain to look for those positive things to counteract, a few negative things that happen in our life. So sense of awe is sort of the same concept, right? You look for sense of awe, to counteract those anxiety, counteract depression. For example, if I asked you to think about, your favorite vacation memory, right, that you have, it's probably involved you being really mindful and then some aspect of sense of awe, whether seeing vast nature, like in the picture, Grand Canyon, or it could be small things, like if you see your kids, swimming or playing in a pool and they have a good time, that can be a sense of awe, right? Or the first time you see your baby, certainly that's one of the greatest sense of awe, right? So you want to start looking for that. It doesn't have to be big. It doesn't have to be during your grand vacation, but everyday life, you can find that sense of awe. I'll give you one, like the fact that you are here, in one place, right? I mean, that's awesome, right? Yeah. The fact that, multiple things have to go right? The hurricane is not here yet today. Your flights are not delayed, all the AV, everything functions well, you think about how many things went right in order for us to be here. So that's a sense of awe, right? And then you want to celebrate small wins every day, right? You don't have to wait for big wins, like the new about remission or world peace, right? But you can celebrate small win. Today, the weather is not bad. That's a small win, right? Today, your pain is a little less than yesterday. You're able to do more things. That's a small win. You celebrate that. Okay? And then lastly, you want to develop that personal practice to lower your stress. And that's mindfulness, right? It could be breathing, could be yoga, could be mindfulness, right? So I know that I'm running over time, but so I'm going to skip that last few slides on mindfulness. The reason is that's a very common topic that you can look up. There's a lot of articles, video, YouTube, books about this, and I encourage you to find out more about mindfulness. Okay.
Session in the morning
Yeah,
about mindfulness led by 2 patients who practice mindfulness. So this will be great follow-up. So this is wonderful.
So I'm just gonna leave you with this quote that mindfulness is really learning to pay attention how we pay attention, right? Because in the end, your experience of being alive, your life experience only consists of the moments that you're mindful. Okay. So let me end on that note and just, to have a couple of minutes to answer your questions.
Yeah,
okay?
So this is your chance to ask Dr. Lolak. This was fabulous. And again, we do have a follow-up about mindfulness. So thank you for going a little quick at the end, but I think, this is a stressful diagnosis. We know that. And we know that there's depression, there's even high rates of suicide. And so we do want to open it up to questions. And being connected is part of that support system. So thank you so much. That was wonderful.
You're welcome.
Yeah, thank you. That was a very comprehensive and accessible talk. I appreciate it. I was diagnosed 2 years ago, had a radical cystectomy and a neo. I was pretty good during the day in managing my stress and anxiety, but at night, out of control. I couldn't sleep. Insomnia became debilitating, and I was prescribed for the last 2.5, 3 years sleeping pills and tranquilizers, which I'm now realizing is a whole nother problem, needing to get off of them. What role do you think those should play in anxieties that we often deal with?
You mean the medication? Yeah, the medication is sort of double-edged sword, right? Because in some situations, especially acute situation, where you cannot function because you are so sleep deprived, just to have a little bit of sleep can help, right? Because the mood, the energy, everything got worse when you're not sleeping. And if you try, let's say, exercise, you try what we call sleep hygiene. So that's another thing to look up. Sleep hygiene is a practice that can really help with your sleep. And that still doesn't work, then the medication is recommended as a short term. So the challenge is, because the nature of how this medication works, a lot of people have trouble getting off of it. So it requires a lot of, discipline and instruction and more support, to help you to find strategy that can maintain sleep without medication. Having said that, there are cancer patients that in the end, because of their chemistry change in the brain or because of their some of their cancer treatment that really affect their sleep, that whatever they try, they cannot sleep. So in some cases, there might be a role of using medication on a longer term basis.
So I've got a comment and a question. So BCAN and some of us have been involved with research, patient-centered research related to anxiety and discomfort for cystoscopy, something that all of us have experienced. So there is, on the patient side, research related to that. I wanted to know if, so this is obviously a lot of information about how to deal with this. Is there sort of a guide for caregivers to help out their partner dealing with this? Is there training for them? Obviously, some people might not end up going to a doctor to have this diagnosed, but is there helpful information for a caregiver?
I'm not aware of a specific ones, but I'm just gonna say a couple of things. First, being a caregiver is a lot of times equally or more distressing, than being the patient, right? And that's true for many spouses, many parents. If you're dealing with your kids that have cancer, so whatever things of support that I mentioned, it can still be good for the caregiver. There's the counseling, the practices, the mindfulness. But I'm just gonna say one thing about being a caregiver. When your loved ones are really kind of going through some tough time and dealing with anxiety, I would suggest that instead of thinking about ways to fix it, you want to first turn towards the person who have anxiety, the person who is struggling, and just hear, right? And just hear with all your heart and body what they have to say, just to acknowledge that suffering. A lot of times, I'm sure you may be aware of that. Sometimes you don't really need a solution. You just need to be able to express your discomfort, your stress, what you're going through. But when you have cancer, right, every time you turn to someone, they give you, a suggestion. They give you a way to fix it without really kind of acknowledging, what you're going through. So one of the things that you can do is really to be there, be present, right, without turning away, without trying to prematurely fix it or give a solution, and that a lot of times that can be really helpful.
I just wanted to echo that as a caregiver for 8 years. Everything that he said applies to us as well. And maybe sometimes even more so, because we go through the same stress and yet you're feeling maybe you don't deserve to. You don't need to talk about it because you're not the one with cancer. But I believe from personal experience, caregivers go through everything that their loved ones do. The only difference is we might not have some of the same physical effects, but you need to take care of yourself first, because if you can't take care of yourself, you can't take care of the loved ones with cancer.
There's another question over there.
I'll just add to that. I truly believe it's harder on the caretaker than it is on the person.
Well, caretakers are the ones that want to fix it, and it's hard.
When I was first diagnosed, I have a lot of friends and a lot of great colleagues, and many of them would call me or ask me, what can I do for you? Is there anything I can do for you? And my constant answer was, you can say a prayer for me, because that's the best thing you can do for me at this point.
And sometimes when people say, how can I help you? What can I do? You're actually putting an extra burden, especially on a caregiver or the patient, because then they have to think of what they need to tell you. So, if you're working to help somebody, make some suggestions. I'm going to provide this. I'm going to do this or do that for you. Which would you prefer? It might be easier than asking them, what can I do for you? Because then they have to stop and think about it. So that's something that we hear all the time. And all of that information is obviously in our Tips for Caregivers book, but these are really good questions. So what other questions?
Thank you for your presentation. I'm actually a recipient of the value that Life with Cancer has brought. And I just wanted to, I guess, first of all, say thank you for this presentation. Prior to my cancer diagnosis, I'd never been to a therapist before, after which I had a lot of anxiety. I'm still really struggling with anxiety. And I guess I would ask you, like right now, I'm working with Life with Cancer, and it's free, obviously. Do you have any recommendations to patients who want to continue that counseling long term? How do you go about finding the right therapist? Do you recommend that we search for certain credentials? Thank you.
Yeah, this is a tricky one because as you know, it's these days, especially since COVID, it becomes a little more challenging to find a therapist, especially if you rely on your health insurance. But depending on where you are, you might be able to find someone. I would say the best way is probably talk to. So I think most of the cancer centers should have what we call the supportive arm of it, and they may have a nurse navigator. They may have a social workers that specialize in oncology. So I would say talk to them to see if they can give you any kind of guidances, because there might be some local clinic or facility or therapist group that have a little more familiarity with cancer patients, right? And then, but if that's not possible, or you don't get anything from that, then the next step would be to do some research online. Usually, we recommend that the patient goes to this website, psychologytoday.com. Even though it's a website of the magazine, but it actually has the listing of the therapist that probably most comprehensive, at least that you can find easily on the internet. So that one you can narrow it down in terms of where you are, your location, the specialty, the credential, their hours, their insurance, and you just have to try it out. So yeah, but I recognize that this is challenging for many patients.
Okay, we have time for one more question. So Daryl, you'll be the last one.
So, sometimes depression can be a spiral. And we talked a lot about how do you come to that awareness that you're in that spiral? Because before you can get out, you have to do that first step of acknowledgement and reach out for that help, support, or even an intervention from somewhere else.
Yeah, I agree. So when your depression is a little bit more severe, sometimes it can be hard to even do those things that we talk about, right? So that's when you really need professional help. So either seeing a therapist or psychologist, or even start with talking to your oncologist or your primary care physician can be helpful. Because if your depression is really severe, you might benefit from a medication specifically for depression. And those medicine can be prescribed by your oncologist, can be prescribed by the primary care practitioner. They're familiar with those medicine, at least some of the standard ones.
Well, Dr. Lolak, thank you. This has been very informative.
you, everyone.
Again, we're really working to help you thrive in survivorship. And I hope that this has given you food for thought. You know, it's hard to talk about how you're feeling and let it go out there so somebody else understands. So as caregivers, you know, you can certainly ask, but also just listen. And as a patient, try to think about how you can articulate the stressors that you're feeling, because there is help out there. And, you know, again, support is also really critical. And you can get that from caregivers and friends that you're going to have meeting here today. So thank you all so much. I appreciate it.